A disability is something that has a major impact on your life.
Every disability is different.
And it's never the same thing for two people. I am blind in my right eye totally, and partially sighted in my left eye.
I was 18 years old. We were traveling way too fast on a gravel road. Broke my neck, my back.
My Asperger's syndrome and my cerebral palsy.
I have anxiety and depression. People would have no idea just talking to me.
Being independent means different things to different people.
I want to live in my own house. I want to pay my own bills.
Live independently and not rely on other people.
When someone is not able to live as independently as they can, it does have a detrimental effect on people's physical and mental well-being.
It's no complicated thing. It's just that people with disabilities want to be included.
Plenty of people get stuck in ruts when they feel like they can't overcome something in their life. That's where LIFTT comes in.
Living independently for today and tomorrow. LIFTT. We help people of all ages and all types of disabilities find the resources or acquire the skills to live as independently as possible.
We serve the southeastern 18 counties here at the Billings office. We have a variety of things that we offer. We can help with grant funding for adaptive equipment.
Maybe a home modification so they're able to access their home. We help people to find that funding.
Helping people apply for Social Security benefits.
Medicaid, Medicare, housing.
They have a peer support group. Peer support, I think, is key.
Sharing life experiences is one of the most powerful things to help people who might be new to disability, who might be struggling with their disability.
Youth transitions is kids that are transitioning out of high school. They need to learn those adulting skills. It might be rent an apartment, learn how to grocery shop, budgeting.
Help someone advocate for themselves in a school or an employment setting. One of our biggest strengths is providing folks with information and referral. If we can't help you, we hope to know who can.
A lot of times we'll have a potential consumer call in and they think that they just have one need, and it turns out that we end up finding 3 or 4 things we can actually do for them.
You can just come in and say, hey, I feel like I have this going on. Can you help me? And we can, which is so cool to me. I love that.
Most of us on staff at LIFTT have identified ourselves as having one or more disabilities. That is helpful in many cases.
It's easier to empathize with someone when you yourself have struggled with a disability.
This is what we specialize in. This is who we are, and this is what we do.
And it costs nothing to go to LIFTT. It's a nonprofit organization and they're there to help.
Somebody that was a consumer that was working with LIFTT was asked to do an art project. He visualized that the balloon helps to lift people up. And then it became the logo, and it's stuck.
There's been success on all kinds of levels.
It's really rewarding to have a consumer go, hey, I was able to do this by myself today.
We want people to live their best life as independent as possible.
Live as everyone else in society and live as a part of society, not up from society.
Everybody needs help. Sometimes you just need a little more help, and that's okay. That's absolutely okay.
There's plenty of life to live still, and there's a way you can do it. Keep chipping away at it, little by little by little.
Knowledge is power. Let's share it, for crying out loud.
Send us an email, give us a call. We'll do our best to help.
We can definitely help figure out what your needs are and get started on that. We're one of many steps in the path to independence, and we're happy to be serving people here in the community.
Good day and welcome to Living Well in Montana. Living Well in Montana is a program of living independently for today and tomorrow. LIFTT, L-I-F-T-T, as we often style ourselves. LIFTT is what is known as a Center for Independent Living, meaning that we are a hub of programs, services, advocacy, and resources for persons with disabilities. LIFTT serves a 18-county area in southeastern and south central Montana. And again, the primary focus of all our programs and services is to promote the independence and self-determination of people with disabilities. For more information about LIFTT and our programs, please visit us on the web at lift.org or give us a call at our Billings office at 406 or in Glendive at 406-948-8500. Today on Living Well in Montana, we are joined by LIFTT's nutritional health and wellness coach, Eileen Rodriguez, and Eileen is here to talk about and hopefully maybe encourage some folks to join up with the next cohort of our diabetes prevention program, which starts June 4th. Yes. Welcome, Eileen.
Thank you.
So let's talk a little bit about what the diabetes prevention program is. What does it entail for those who participate in it?
Sure. So I'm excited to share. It's a year-long program, which sounds like a lot, but it's well designed that the first probably about 4 months, it's a weekly session, really gives people the foundation that they need to...
Again, is it an hour session?
Yes, they're just hour-long sessions, once a week, and they give people that foundation of what they need, really to guide them to make healthier choices for managing and preventing diabetes to develop. And then after that, we spread it out to every other week, and then pretty soon it's just once a month. So as they gain confidence, they're able to just come check in. They really like that accountability a lot of times. So knowing that somebody's there to support them, they come together as a group and get really, enjoy each other's company and enjoy suggestions from one another.
Okay. And what does what do the sessions involve, I guess? Particularly those first several months where it's every week.
Yes, so it really concentrates a lot on getting people to move more and even knowing how to adjust their meals so that they're not raising their blood sugar levels, and getting ideas from the curriculum, but also from one another to get that under control, which really is quite beneficial.
So there's almost like a nutritional component and a
exercise
or physiological component.
Absolutely.
Okay.
Yes, and that's why at LIFTT we also offer some exercise classes so that people can join in.
Right.
It's easy to join into those classes. It's really going to help manage, your pre-diabetes and prevent getting diabetes.
Okay.
So.
So what makes this class stand out from other diet and exercise programs?
Oh, good question. Right, so it definitely is focused on diabetes and how it can be helpful. One of the big things is we always stress that these are just small changes that people are making, and they're really something that people can incorporate into their lifestyle. It's not a diet, it's not to try to lose weight quickly, it's how do I make this part of my life? So.
And again, it's designed, there's a, and forgive me, the medical is always a little foreign, but there's a particular number.
Oh yes, your A1C?
A1, thank you. And
yes.
folks who are pre-diabetic have an A1C in a certain range, and then...
Correct. Yes, and once you get to, good question, and some of those numbers escape me too.
Right.
But once you get to that close to diabetes, that's when people do get really nervous. But yes, your doctor can tell you, and even looking to see, ooh, am I falling in those ranges? And some people sadly don't take it seriously at first, so, or they may be told they're in that category and are not really given options of what can I do. So this class is really good to get people on
those
track.
Those numbers can be brought down, for, particularly, and again, it's important to say that we're talking about the prevention of type 2 diabetes. Type 1 diabetes is a whole nother kettle of fish.
Correct. Yes, actually it's got in people under 50, it's got a 50% success rate. When you get over 50, it's more of a 70% success rate. So it really is effective. Okay. I like to think of my mom as a good example. She's discovered she had prediabetes over 20 years ago, and she took a class like this and amazingly was able to keep it at bay all this time, and now she's no longer considered pre-diabetic. So it definitely is manageable and preventable.
And it is relatively common in our community.
Yes, like 1 in 3 people have pre-diabetes. So you don't even have to have those A1C numbers. We have a risk assessment, and even if you meet that risk assessment, it's based on, your age, your activity level, your weight, things like that. And if you're just at risk, and if you have a family history, it qualifies you for our program.
Okay. So. And there aren't very many programs like this in our community, is that you were telling me earlier?
That I am aware of. I know that Intermountain Health has one. There have been other programs, but they, for different reasons, have not been able to continue on. So it's great that we are able to offer it through LIFTT. And it's, you mentioned that we serve people with disabilities, but I think there's kind of a misconception what that means. If you are at risk of diabetes, that does put you at risk of becoming disabled. So
certainly
we definitely,
in and of itself is considered a disability.
Exactly. So that shouldn't be a barrier for people to use our program.
We're not saying you must be pre-diabetic and have another existing disability. The pre-diabetic is enough to get you in the door for the DPP program.
Exactly. Yes.
And it's a curriculum that you've been trained in, correct?
Yes. So the state of Montana has training, and they're the ones that oversees all the programs in Montana. It's CDC approved, and they keep track of, the success rates. They're really great about letting us, all of our programs across the state, get together and share ideas, share encouragements. So as someone that facilitates that class, it's really encouraging to hear other people's ideas and what's happening across the state too.
So is one of those things that you have to ask, is there a cost to the participant for the program?
Right, great question. So thankfully at LIFTT we do have grants that allow us to offer these classes free of charge. So really I joke around that one of the things that you do need to do is we have paperwork because we do report to our grantors. So making sure that people understand that there is some paperwork to fill out, but as far as a charge, there is not.
Again, do you spend the part of that first class doing the paperwork if people haven't done it before?
Right.
Or do we?
Yes, a lot of times that first class, it's goal setting and thinking of that bigger picture of what you want to do in this year class. But part of it is, yes, we will make sure that the paperwork gets done.
Okay.
The wonderful thing about it, once that paperwork is filled out, it allows you to take any of our other classes. So if it's all right, I'll highlight some of our exercise classes too.
Okay.
So just as this class rolls out, I lead Tai Chi, and there is a special Tai Chi for diabetes program.
Oh, okay.
So just as this is going to begin, we'll have the class on Thursdays from 10 to 11, and then at 11:30 there will be a Tai Chi class. And the great thing about Tai Chi is it's accessible to anyone. People can sit and do it, they can do it standing, but it is something that's actually gaining a lot of popularity, and they just see that it's a great way to get people moving, even if people have arthritis or just maybe mobility issues. It's a great thing.
And again, it's eminently adaptable for seated, standing, walking, rolling.
Exactly, yes.
So that's that's one of the
And
great things about Tai Chi, and we have that twice a week.
We will, starting in June, we will have it Tuesdays and Thursdays.
Tuesdays and Thursdays.
Yep.
Okay.
And Thursday specifically is for diabetics.
Oh,
So
okay.
again, prevention of diabetes. So,
Okay.
so. And I love it too that it helps people prevent falls, which we also have SAIL, which is staying active and independent for life. And that class is falls prevention, and we do light weight training. So as people age, they start to lose muscle. And amazingly, that goes right along with the diabetes, that if you're losing muscle, you're not burning the glucose like you should be. So maintaining that lean body mass is really helpful for preventing diabetes.
Going back to DPP again, what is the time commitment?
Good question. So really what we cover a lot in class, that hour a week, is people can just do that, but we of course encourage people to go home and think about this and start implementing those lifestyle changes. So, ideally people will get to the point that they're exercising 150 minutes per week, which is for anyone.
Roughly 30 minutes a day, 5 days a week, right?
Exactly.
Okay.
Yes. So that's really ideal for anyone. So if you're not exercising, that might add a little more time too, but it also it's encouraging to people and becomes something that people start to enjoy when they start realizing that they're feeling better, spending that little extra time during the week.
You've been at LIFTT almost 2 years now, and it's been almost 18 months since, again, you went through the training that you mentioned with the Department of Public Health and Human Services. And as a matter of fact, as we speak here, we have a second team member going through that training will help you facilitate this class in the future. So in that 18 months, we've had time for a couple, maybe 2 or 3 folks. Have you seen folks go through the entire year program? And
Yes, we've had at least 2 classes finish, and another one will finish actually today. So we do offer the classes periodically. So in that 18 months, every few months we do roll out another class.
Right.
So it's,
And what are some of the sort of success stories that you've seen, if you'd like to highlight?
Sure.
One.
So a lot of times we do see some of the goals that the program has is getting people moving more, and then just dropping 5 to 7% of their body weight amazingly starts dropping that A1C too. So when people start implementing these changes, they do start losing a little weight, and when they go to the doctor, it's very pleasing to them to see, hey, my A1C is starting to drop. So we've had people just in particular that say, I didn't realize how important this was, and just really take off with it and say, I do enjoy exercising. I do, like these lifestyle changes. And they do see it in their numbers when they go to their doctor.
Okay. So is there anything that anyone who happens to be flipping through the channels at home, again, please, if you're interested, sign up for the class, but
Yes.
is there anything that, maybe somebody is just flipping through the channels or is outside of our service area and finds us on YouTube or something can do today to start?
Right. Yes. Okay. So just in general, what are things you could do
for better health?
Yes. Again, movement is very important. Sadly, they say sitting is the new smoking. So when we're sedentary, it really has harmful effects on our health. So that's one of the things that the program really kicks off with. And just in general, when people start moving a little bit more, they actually start making better decisions. And they say, I have moved more. I am going to start eating healthier too. So just incorporating movement into our life gives people that boost sometimes that they need.
So I guess, it is a curriculum, you said, and so how is the curriculum sort of organized? I guess?
Right, yes. So it really entails quite a lot. They gradually step us through, those starting points. What does a diabetes plate look like? And then it will dig a little deeper as the curriculum moves on, even into other topics like stress and sleep, and even things that trigger us, like going to the grocery store. What are some of those good practices to make healthy choices at the grocery store?
And you've been able to, with the cooperation of, I can't remember exactly who, but and it's been different local grocers at times, but organized grocery store too,
yes,
DPP classes, right?
There
was one, just a few months ago.
Yes, just recently. This was actually a grant called Food is Medicine.
Oh, okay.
And it acknowledges that when people have healthy food, it has a huge effect on our health. So, that was a great program. They could go to the grocery store. We gave them a general tour. The fun thing was, at the end of the tour, they went home with a bag full of groceries and some recipes. And the feedback is always so fun to see that, they're excited. They've tried something new. Oh, I've shared these recipes with my friends, and it's kind of gets them on track and helps them see.
You sort of bring together, these people who may not have known each other before they walk into this class, and they become a community, at least.
Yes. Yeah, that's really one of the fun things to see, is they are a good encouragement for one another. And what one is maybe struggling with, somebody else is also. And, a lot of it is them sharing. We facilitate.
Right.
So we're always...
the peer support model.
Exactly, yes. And it's more encouraging when people come up with a plan for themselves. It's not, oh, you need to do this. It's, oh, that gives me ideas for things that I can start doing.
Right. And that, again, that's exactly what we try to do within the entirety of our independent living programs and services. As one of our colleagues says, it is the consumer who drives the bus of the services and programs we offer, that we are along to facilitate, to lend a hand. And it's nice to see that extends to what, again, in the hands of others could be a very formulaic and top-down situation, but it's nice to see that it seems adaptable to our independent living philosophy.
For sure.
Okay, we've got a few more minutes here.
Yeah. So just speaking of that, I really think that, that's one of the keys is people come up with their own, they see that there are maybe challenges, and the curriculum will point out a lot of those challenges. And even as they read through, a lot of times there's kind of case scenarios, and they'll read through them and laugh and say, oh, that's me. Or so it brings up points in the curriculum that's very common to many people. So it's fun to discuss that. And a lot of times it comes out as, so if that was your friend, what would you maybe encourage them to do? So it really does become, seeing it from a bigger picture and coming back to themselves.
Idea of that working out the solution as opposed and adapting solutions for different realities as opposed to one size fits all.
Right. Yeah.
Okay, so and if somebody who's watching this is interested in the diabetes prevention program, this next round of it begins on Thursday, June 4th at what time?
Correct, at 10 a.m.
And that's at our Billings LIFTT office, which is 1241 Crawford Drive.
Yep.
Is this program available to be taught online, or?
Yes, we can. If somebody is not able to attend in person, they definitely can do it virtually.
Okay.
The nice thing is when the winter hits, that becomes a nice option too. So if there's a night that, we don't want to leave our homes, we can do it virtually also. So you have that flexibility.
Okay, so there's a virtual option available as well as the in-person option, and it'll be that same Thursday morning time once a week for
about 4 months.
About 4 months, and then every other week for a little while, and tapering off to sort of a once a month check-in. Correct?
Yes, correct. Yep.
All right. And how do people get a hold of you to sign up or ask more questions?
Yes. So you can email. My email is Eileen, EILEENR, as in Romeo, at LIFTT, which is LIFTT.org. You're welcome to call. My number is 406-294-5185, or you can just call LIFTT and they'll
if you give us a call at our main number, either in Billings at 406-259-5181 or in Glendive at 406-948-8500, they'll certainly be able to connect you with Eileen. Eileen Rodriguez, thank you very much. We hope this class continues to go well, and that you have a lot of people sign up for it.
Yes.
So again, this has been Living Well in Montana. Living Well in Montana is a program of living independently for today and tomorrow. LIFTT, LIFTT. Thank you and good day.